Hi, at Pulsar Health, we're all about beauty based on health. If you've got a soft tissue injury, you're going to have some pain, and if you're not getting better, that's the time to come see us. We do like you to take about 4 to 6 weeks to try recovery by yourself, obviously with things like RICE advice, rest, icing, compression, elevation. But if you're not getting better and the body needs a little extra help in order to recover, come in and see us. So the tools we have to help you with soft tissue injury include the SoftWave device. We also have steroid shots and PRP shots, as well as something as simple as LED light therapy. Shockwave therapy works on acoustic technology. So what that means is sound waves are emitted from the head. They do make a loud noise and it's a little bit jarring, but it's not painful. The therapy actually feels better. It only takes 10 or 15 minutes. We don't use it directly on bone, but we use it on soft tissue. It's approved for golfers' elbow, for those soft tissue injuries that just aren't getting better. What it does is it brings in new blood flow to the area by encouraging new blood vessels to form. It also works against chronic inflammation and allows the area to actually heal. One treatment will have you feeling better, but if you want to really heal the area, we recommend 2 or 3 treatments for a few weeks until you've recovered and got over that injury. Now, sometimes you want to have a steroid shot if something's been a problem for a long time. We use steroid shots in areas like the trigger finger. We also use them for chronic inflammation in the neck area, for many things, for scars. But for pain, the steroid shots can be helpful because they stop the chronic inflammation and put it on pause to let your body's healing kick in. We use steroid shots a couple of times if needed, but we don't like to do them repeatedly because over time steroid can thin your tissues and it can interfere with healing. Where we don't want to use steroid, we can use PRP. Now, PRP means platelet-rich plasma. We like to use the kit from Juventix. The blood is drawn, your own blood, and then we concentrate the platelets. We also do something called photoactivation to make our PRP even more potent. Once we've got some very strong PRP, we inject it back in. We look at what area is causing you discomfort. I've used it so effectively in the Achilles tendon area, in joints. We have to be careful with joints because you don't want to inject PRP when the joint is swollen. It's more for the soft tissues when they just aren't getting better. So the PRP recruits other healing molecules to come in and again interferes with chronic inflammation. It is uncomfortable. The PRP is tolerable because we do ice, we give you other things to make it comfortable for the injection. The injection only takes like less than a minute, but the effects last forever. The effects take about 3 days for the discomfort to go away completely, and it takes about 3 weeks for you to start seeing the effects kicking in. Sometimes 1 PRP shot is enough, sometimes 2 or 3 are what's needed to really get the healing going. And a very simple treatment we have is the LED light. Now, the LED light we have here is one of 3 different types of LED lights we have at Pulsar Health. This one has infrared as well as blue and red light therapy. This is the strongest of the class 1 devices for LED lights, so it really helps augment your healing. So if you do have questions about soft tissue injury, you want us to see you and to help your recovery process, just call and come in for consultation. This is Dr. Gill at Pulsar Health.